EAACI, the European Academy of Allergy and Clinical Immunology podcast.
Hello to everyone and welcome to a special edition of the EAACI podcast. I am Maria Torres, President of EAACI, and today we have an exciting and important discussion ahead. We are very proud to announce a new initiative, the launch of Anaphylaxis Awareness Day, which will take place on November 21st, the first day of our upcoming FAAM-EUROBAT 2024 event in Athens, Greece. Anaphylaxis Awareness Day is a groundbreaking step in our mission to raise global awareness about these life-threatening allergic reactions. Joining me today are three outstanding experts who will help shed light on why this initiative is so critical. First, we have Professor Mohamed Shamji, EAACI Secretary General and a leader in allergy research. We are also joined by Professor Asli Akkor, Chair of our National Society Committee, and Ozlem Ceylan, Chair of the Patient Organization Committee. Together, we will explore the reasons behind Anaphylaxis Awareness Day, the challenges people face, and the ways we can help improve their lives through education and advocacy. Mo, I would like to start with you. You have been at the forefront of EAACI efforts in allergy and clinical immunology. Can you talk about why we decided to launch Anaphylaxis Awareness Day and what we hope to achieve with it?
Absolutely, Maria. The decision to launch Anaphylaxis Awareness Day came from a very real need. Anaphylaxis is a condition that is on the rise. It affects 1 to 2% of the world's population, and its impact is devastating when people don't know how to respond particularly. It is a medical emergency that can be triggered by anything from food to insect stings or medications. With the rates of anaphylaxis increasing, particularly in children, we felt that it was time for a dedicated day to focus the world's attention on this particular issue. Our goal is to educate, prevent, and empower people with the knowledge they need to save lives.
And Mo, from a medical standpoint, can you give our listeners a sense of just how dangerous anaphylaxis is? How quickly does it develop and what can be done to prevent fatal outcomes?
Anaphylaxis is a rapid and often unpredictable. It can start with minutes of exposure to an allergen and progress to a life-threatening symptoms like difficulty to breathe, so breathing is a problem, a sharp drop in blood pressure, or even a cardiac arrest. The key here is an immediate recognition and action that is required. The faster someone administers adrenaline, the better the chances of preventing severe complications or death. Sadly, delays in treatment happen too often simply because people don't recognize the symptoms or don't have access to the right medication. That's why awareness is so crucial, Maria. If people know that the signs, if people appreciate and are familiar with the signs and they have an action plan, we can drastically reduce fatalities.
So thank you very much, Mo. Asli, I want to bring you into this conversation. You are deeply involved with our national societies. How do you see Anaphylaxis Awareness Day making a difference on a national and global level?
Thank you, Maria. Anaphylaxis Awareness Day has the potential to make a massive difference, especially when we think about it as a global movement. National societies are uniquely positioned to localize these efforts and tailor awareness campaigns to their specific populations. We'll be working closely with healthcare professionals, schools, and even policymakers to ensure that there is a broader understanding of anaphylaxis. In some countries, people still lack access to basic information, and even healthcare professionals may not always recognize the urgency of the condition. This is where national societies can step in, create educational programs, and ensure that the right infrastructure is in place, such as making adrenaline auto-injectors more widely available.
That is a great point, Asli. Making sure that there's both awareness and accessibility is a key. Ozlem, I would like to hear from you. You work closely with patients' organizations. How does an initiative like Anaphylaxis Awareness Day impact the life of patients and their families?
It's truly life-changing, Maria. Patients living with severe allergies live in constant fear of potential anaphylactic reactions. This fear can affect their daily lives, where they go, what they eat, and even how they interact with others. For them, Anaphylaxis Awareness Day means more than just information. It's a day that brings visibility to their challenges. When the public is more aware, patients feel safer, and they know that people around them might be able to help in case of an emergency. Patient organizations will be critical in sharing real-life stories and offering support. It's about building a sense of community and empowerment.
Ozlem, can you please share a personal story or example from your work with patient groups that illustrates the importance of this kind of awareness?
Absolutely. As an allergy patient, I experienced 3 episodes of anaphylaxis during my childhood. All these incidents occurred in outdoor settings where my parents had limited control. These incidents highlight the fact that protecting individuals, particularly children who are at risk of anaphylaxis, requires more than the efforts of patients and their families. It involves the active awareness of everyone in their environment, including schools, restaurants, hotels, workplaces, and beyond. This is why Anaphylaxis Awareness Day is so important. It's not just about prevention, but ensuring everyone knows what to do when seconds matter. Additionally, establishing a referral system to an allergist after the treatment in the ER is critical. This follow-up plays a significant role in identifying triggers, understanding cofactors, and developing a personalized action plan to prevent and manage possible future reactions.
Thank you, Ozlem, for sharing that story. It's a reminder of how much awareness can mean the difference between life and death. Mo, from a medical research perspective, how has our understanding of anaphylaxis changed in recent years, and what does the future look like for treatment and prevention?
Our understanding of anaphylaxis has deepened considerably over the years. We now have a better grasp of the immune mechanisms that trigger these severe reactions, which have led to the improvement of diagnostic tools and the development of new therapies. We're also seeing advancement in preventative treatments like oral immunotherapy for food allergies, which has the potential to reduce the risks of accidental exposure, which is important, particularly for the patients. But there is still much more to learn and to do, especially when it comes to preventing anaphylaxis before it even happens. That's why awareness and continued research go hand in hand. The more we know, the better we can protect those at risks.
And this research is something we will be highlighting during FAAM-EUROBAT as well. Is this correct?
Yes, indeed, Maria. The EAACI FAAM-EUROBAT is the perfect platform for discussing the latest findings in allergy and immunology research. We'll have sessions specifically and especially focused on anaphylaxis, including expert talks on managing severe allergies and preventing reactions. It is also an opportunity for healthcare providers to engage with the latest treatment guidelines and practical recommendations. I encourage everyone attending the EAACI FAAM-EUROBAT focus meeting to participate in these sessions and become part of the global effort to fight anaphylaxis.
Thank you very much, Mo. So, Asli, looking ahead, how do you envision national societies contributing to the long-term success of Anaphylaxis Awareness Day? What initiatives do you think will follow?
Looking to the future, national societies could take this day and expand it into an entire week of awareness activities, much like how other major health initiatives operate. This could include training programs in schools, partnerships with local governments to improve allergen labeling in restaurants, and even legislation to make sure that public places are equipped with adrenaline autoinjectors. The possibilities are vast, and I believe that with the momentum we're building, we can push for real systemic change in how anaphylaxis is understood and managed worldwide.
That is an exciting vision, Asli. It also shows that Anaphylaxis Awareness Day is just the beginning of a much larger movement. Before we close, I want to thank Mo, Asli and Ozlem for sharing their insights today. To all our listeners, remember that November 21st marks the first Anaphylaxis Awareness Day, and it will be an opportunity for all of us to learn, share and advocate. We invite you to join us in Athens for EAACI FAAM-EUROBAT 2024, where we will dive even deeper into these important discussions. Stay tuned to our social media channels for more updates and resources. Together, we can raise awareness and save lives. Thank you for listening.
All EAACI's podcast episodes will be available on Apple Podcast, Spotify, Google Podcast, and YouTube. See you on the next episode. EAACI, the European Academy of Allergy and Clinical Immunology podcast.